My guest today is Dr. Asha Mohammed, permanent representative of the IFRC to the African Union and international organizations in Addis Ababa. Welcome.
Thank you very much.
So, before your current position, you were the Secretary General of the Kenyan Red Cross National Society. And this was after a really long career in public health and as a frontline worker in Kenya. And you've spent your life working to improve people's health, fighting infectious diseases such as HIV and AIDS. And for the Red Cross, you worked on the entire range of humanitarian challenges. I understand that your first experience working alongside the Kenya Red Cross was after the bombing of the US Embassy in Nairobi in 1988. And it seems that day somewhat changed your life. Can you tell us about that day, that experience?
Yes, still very fresh. I was working with the Ministry of Health then, in particular in the Provincial Medical Office for Nairobi, and I was acting as the Provincial Medical Officer at the time. We were also part of a disaster committee that was chaired by the Provincial Commissioner at the time. And this particular morning, I was just standing in the office and looking out of the window, and suddenly, I had this big bang, and the sky was filled with dark smoke, and we were all just trying to, what could it be? And everybody, of course, was up and down until we managed to get the information that actually there was a blast. So, of course, we mobilized quickly under the guidance of the provincial commissioner. And, of course, for us being the health office, then we, of course, took a good lead in terms of the responses at that time. And that is where I met the Kenya Red Cross in those coordination meetings and also on site in terms of the work that was being done. And I can say I admired how they worked. I admired the volunteers, people who sometimes you even had to tell them, please don't go in there, because they had this drive and motivation that they didn't care too much about themselves even, that they were willing to just rush in and be able to save others. So I think, of course, working with them several days later in the aftermath of this, got to know them and thought that this is probably the next thing I would like to do in life. And somehow an opportunity presented itself, not immediately, but a few years later, where I had then the opportunity to start as the Director of Health for the Kenya Red Cross.
And then you went on to take other leadership roles within the organization. What was it like to be a woman expert and a manager at that time in Kenya?
It wasn't, I'll say, not easy, but at the same time, I think we had a number of women in different roles that also were a good motivation. Like I said, in the provincial office, at the time of the blast, I was acting, but my manager at that time was a woman, and she was away at the time. Also, when I joined the National AIDS Control Council, when Kenya declared HIV a national disaster, I also had a director who was a woman. So I had a few people that I could look up to and get motivated. But what was clear, of course, is that even for them, they had to fight a lot of prejudices along the way, which didn't also, I would say, I wasn't spared either. And so it was a continuous struggle. But more importantly, I think it was also the conviction to say, yeah, this are probably just distractions along the way, and I just need to concentrate and do what I need to do and get to where I want to go.
Would you say that you had to go through things or experience challenges as a woman that your male colleagues did not?
I would say yes. Even when you thought you had done your best, even when you thought you had succeeded, it was still considered either it wasn't good enough or it's almost like somebody must have helped you to do it. So, which means, like we say, you have to work 3 times harder than a man for you to be appreciated and to be recognized. I think the most difficult, of course, was when you were a manager and you had a team of many men. Then sometimes you felt like, well, they would listen to you, but at the same time, you felt like they weren't too sure whether you were giving them the right direction in that sense. So, but I think with time, it's like almost when you prove yourself, and then you are able to now get the confidence. But it never stops at whatever level, and I think the higher you go, sometimes the more difficult it gets. And this is, I guess, one of the big challenges that we have, and also because as women. I think now it's a bit different, but during my time, we did not have the same support structure. And that's why I'm very passionate about the Glow Red within the
Hmm.
Red Cross Red Crescent movement, because it has provided a platform for women in the Red Cross Red Crescent movement, even just to share your experiences, even to ask, people you can call and say, I have this situation, what can I do? We didn't have that at that time, and it was very, very difficult in that sense. We would say, well, the men were better organized than ourselves at that time. They had their own groups, and after work they could sit together and share. But we were busy running home to go and take care of the family. So at the most, you're always on your own.
You mentioned Glow Red.
Yes.
Can you talk a little bit about it so that our female colleagues know who to call upon if they need
Yeah,
support?
yeah. So Glow Red is, shall I say, an informal association that we have for the Red Cross Red Crescent women, and this was, of course, I would say, born out of a frustration, and this is how a lot of initiatives come through. When there was an election for the governing board of the IFRC, it was 2017. And out of the realization that we had very few women that were elected, and I think there was a bit of an outrage in that sense to say this is not right, and not in this century anyway. And so a few women then came together and started to reflect and discuss and see what could be done. And so it sort of gained momentum, and I remember the last election in 2022, when there was an election of the governing board. Within just 4 years, the tables turned completely, that we ended up with 53% of the governing board being women. So I think for me, this is why I say it's important to have these support systems, and we hope that the same can translate even at the national society level, because one of the challenges, of course, is always the sustainability. Today we have a group of women who have taken this initiative and push it, but what will make a difference is having this pipeline of women leaders from national societies and within national societies, from the branches to the headquarter. So there's still a lot of work that needs to be done, but I think it's on the right path.
I think you're echoing the words of our president, Kate Forbes, who said exactly the same things about the pipeline. So thank you for that, to reinforce that message for our female colleagues, as we said earlier. So you also mentioned mentoring and how important that is, but you mentor women and men. Can you talk about that?
Yes, I have, of course, a passion for supporting women, but I also have a passion for supporting young people. And so, from the perspective of the young people, then I include both girls and boys, or
Mm-hmm.
and for me, it's really about looking at the next generation. And I believe with what they have at their disposal, with the energies they have, and the things they can do today, then they're our best bet. And so it's important to be able to invest in them and to support them. Like they say, sometimes we say they are the leaders of tomorrow, but tomorrow will be too late if that is when we start to guide them or to give them the capacity they require. So for me, this has been a passion, not only from a professional perspective, but also from a personal level. And I've been part of a group of professionals from my community who started a foundation really just to support young people through different phases of life, and even more importantly in terms of education, being the one of the critical game changers in their lives, and also for the community, because then they will be able to support their communities better. So this for me is critical, and from the National Society perspective as well, believed very early on in the place of young people, to the extent that I made sure that the youth department in the National Society, when I was Secretary General, reported directly to me as Secretary General, and not to have too many other layers in between, because I wanted to hear from the young people themselves at all times, and also to ensure that I gave them the platform and the space to be able to access me and to be able to advise and make recommendations in terms of what they thought was important for them.
Mm-hmm. Yeah. Going even further back,
Yeah.
You started your career as a dentist.
Yes.
What drew you to dentistry?
Very funny story, I would say. I had some dental problems. And so I started to see a dentist at the university dental clinic. And this particular dentist, I would say, was a little bit of an older dentist, I would say, those amongst the fast dentists in the country. And he was, he was very caring. He was very supportive, and he took his time. Whenever I went to see him, he would explain exactly, what what treatment I was to get. And I felt, wow, yeah, a very humane profession in that sense. And then, of course, sitting in the dental clinic and getting fascinated by, the way the dentists looked in their white coats and all the sophisticated equipment, the dental chair and everything. And I thought, wow, okay. I knew for many years that I wanted to be in the health profession. But finally, then I made up my mind that I thought, yeah, this is probably it. And so that's how I started as a dentist.
And you worked as a dentist for a little while, right?
Yes.
And how did that influence you, that experience?
It was, I would say, also the beginning of where I ended up, even with the Red Cross, because I worked as a dentist, but not for very long. I got involved with a group of dentists to provide, I would say, dental care for communities. So we would organize, some dental camps in very remote communities in Kenya. And then when I went to a number of them, I just thought to myself, isn't this better than sitting in the clinic and waiting for somebody to come to you? That it was much more gratifying to be able to go out to the community, see so many people at the same time, but more importantly, interact with the communities and even talk to them about preventing some of the dental problems, as opposed to waiting for them to come to the clinic. And that's when I decided to go back to study public health.
So you grew up in the Kibra constituency in Nairobi, and you're a proud member of the Nubian community. Can you tell us about your community and why that is being part of that community is important to you?
Yeah. The Nubian community is a very, I would say, small community. It is estimated that we are probably about 100,000 in Kenya. Of course, also found in different locations in the country, but the main home, you can say, is Kibra. And the history of the community draws back, a long way from, you can say, Egypt, the Nuba Mountains, and all the way. So we have a long history there. Basically, our forefathers were soldiers. Go with the king rifles, and on their way back, they were settled in Kibra as opposed to being taken back to where their home was. What's also interesting about our community is that we have tried to preserve a lot of our culture, whether it's in terms of food, in terms of clothing, and irrespective of where we go, this is something that is always very, very clear. So for me, this has been, shall I say, probably the biggest motivation as well in terms of having grown in this community. First of all, at that time, education for girls was probably not a priority. It was always, the boys were always encouraged. For the girls, we were told, you need to be a good mother, you need to be a good wife. And I did not understand why you can't do all of it. And that's why for me, even when I mentor girls today, I tell them, you can be what you want to be, and you can also play those roles and play them very well. So it's really about you understanding that you have these different roles to play, and more importantly, that you can find the balance. But I also got a lot of, I would say, support from the rest of the community. And this is how we ended up. Actually, this foundation I talk about is from Kibra, and we've been supporting young people in the community. A little bit, I would say, shall I say, a few challenges still exist. And that's something we hope that the Kenya government will support because, for example, we are still not recognized as a tribe in Kenya. We are in this category called others, but we have a good promise from the president that before the end of this year, hopefully, we shall be recognized. But all in all, I think that has not stopped the community from advancing and developing in many ways. And today, I think we have very many professionals from the community. But what I love most about it is that each one of them still feels the responsibility to give back to the community. And so it becomes a sustainable model of how we continue to support even the young people that are coming behind us.
And that's exactly what you're doing with
Yes,
your initiatives with mentoring and public
exactly.
health and
Yeah,
all of that.
absolutely. The African Union, as you said, is a body of member states from Africa. And for me, first of all, my role is to represent the IFRC vis-a-vis the African Union and other international organizations based in Addis Ababa. Secondly, it's about creating a strategic platform for African national societies as auxiliary to the African member states. And ensuring that they can contribute and participate in the policy discussions and strategy. And then, of course, more importantly, how that translates into the humanitarian action in the continent and also specifically in countries. So for me, my message really is we have many challenges on the continent, and these are increasing in different forms. Many more people being affected. The duration of this disasters are also increasing. Now we see even the floods in East Africa and how that's ravaging communities. But we have national Red Cross and Red Crescent societies that have the experience, have the capacity, have the know-how to be able to support member states to be able to deal with these issues. So for me, really is ensuring that the African Union knows that they have this structure, that they have this capacity, which is it's really an African capacity because national societies are enacted through acts of parliament by their governments as auxiliary to government. So this is really, homegrown institutions that can bring this added value to the work of the African Union.
Speaking of the African Union, why do we as IFRC have a permanent representative? Maybe you can paint a picture for our audience. Why is the African Union so important or so critical to solving humanitarian issues that we deal with?
The African Union is a structure of the member states from Africa. And so it is a critical institution that has the mandate of member states, and in particular the heads of state, to be able then to ensure that humanitarian action and other issues on the continent, are, coordinated and supported. There is also, of course, the African Union Commission, which is really, the secretariat. And for the IFRC, it is critical that we have this representation office in Addis because our national societies are auxiliary to the member states, which means then we need to be close to where those decisions are being made, but more importantly, close to be able to offer the support in terms of developing, the policies and strategies that are needed, especially in humanitarian action. It is also important that we function as a liaison to the African Union and also other international organizations to bring also the voice of the affected people through and supported by our national societies on the continent.
When it comes to dealing with international issues, and especially humanitarian issues, we often look for solutions from international organizations, especially humanitarian agencies. But it's probably safe to say that for long-term solutions to the challenges, especially on the African continent, they really are coming from Africa itself, from the communities. And the Red Cross, of course, plays a really important role there. What do you see as those solutions, both from the African level at the AU, but also internationally as our representative there?
I think, first of all, is to acknowledge and say that this is something the African Union has been clear about and putting out the messaging about African solutions for African problems, which is a recognition of the fact that we have the knowledge, we have capacities within Africa that can respond to a lot of these challenges. But that's, of course, not to say that the African issues can only then be left to Africa to deal with. But primarily, then, it has to be led by Africa itself. I think for us, with the African national societies, we know that the structure is such that we are community-based, which means that the human resource capacity of the national societies on the continent come from the same communities, which means we are in a good place to be able to contribute because we know the issues, we know the people themselves, and our volunteers come from these same communities. So they are able to bring, the knowledge about what exactly is going on the ground, but even more importantly, that they are there to be able to accompany the same communities to deal with the issues that they have. And I think this is where also the question of how we deal with the long-term sustainability of interventions becomes very critical, because that is where you can rely on the National Red Cross and Red Crescent societies, because they are there to stay.
Hmm. They're there before an issue arises, during and
Exactly,
after.
and after.
Right? Yeah.
Absolutely.
So one of the major issues that Africa faces, or has been facing really for a long time, is hunger. And we've talked to other guests on this podcast about the various causes, from climate change to economics to supply chain disruption to corruption, you name it. But what do you see as possible solutions, both from the African level, um, but also internationally?
I think for me, one of the critical issues is also to begin to look at the hunger crisis as not just a question of lack of food. That, like you say, there are many reasons or causes for this crisis. And therefore, we need to begin to start looking at it from that perspective in terms of our responses, that we stop having, responses that are, vertical, and responses that are not integrated, to be able then to comprehensively address this issue. But even more importantly, that these responses also have to be rooted within the communities themselves. If communities are not involved, then it will not be possible to actually, reach the levels of relief we're looking at. And therefore, we must ensure that whatever we design, or, whatever we, think should be the solution, has to be grown from the bottom, so that the communities themselves participate, because they know better. We know even in the last few years, when we've had a long drought, communities, would be able to propose and say, this is how we think we should be able to deal with it. So for me, I think that's very important. And then, of course, ensuring that there is some coordination, actually a very good level of coordination between the different actors, because otherwise then we are all going in to say we are addressing the same issue, even sometimes in the same locations, but then working in silos instead of putting, our knowledge and resources together to be able to actually maximize on the result.
I mentioned earlier that you've spent a lot of your career working to protect people from HIV and AIDS. That's something we don't actually hear much about these days, but it's not really over, even if it has fallen off the media radar. What is the story today with HIV and AIDS in Africa? What do you think still needs to be done?
You're right that, yes, it has fallen off the radar, which is unfortunate, because the reality is there is still a lot that needs to be done. Of course, we acknowledge that over the years, a lot of progress has been made. But also looking at the context that we find ourselves today, many other factors are coming in to actually erode a lot of those gains. And again, speaking about a lot of the crises we see on the continent today, and globally, whether it's issues of conflict, issues of, the impact of climate change, the displacement that is happening. So people are being displaced from where they have lived, and more importantly, in the proximity of where they have received their health care, which means then there is even disruption in terms of, the treatment, in terms of the support that people living with HIV would take. So for me, I think that is an area that really needs to be looked into. We have for some time been advocating that there needs to be a lot more attention in terms of HIV in emergencies, because that is where we have the biggest gap. And considering that this is increasing more and more, whether it's because of climate change or whether it's because of conflict, like I said, but even for economic reasons, people are moving. So as they move, even with migration, uh, how do they continue to get the treatment and the services and care that they need in those situations. There is also the question of the increase in sexual and gender-based violence, which again exposes many women and girls to new infections of HIV. So I think we need to look at that and be a little bit more deliberate in terms of ensuring that these services are available in whichever context people may find themselves in.
In addition to HIV/AIDS still being present, there's other infectious diseases that continue to take a toll on communities in Africa, from cholera outbreaks that we're seeing right now. Malaria, of course, continues to take lives. And Ebola also arises from time to time. Public health institutions are there and experienced in tackling all these issues. But is there enough investment regionally and internationally to really deal with the issues on a more long-term basis?
I think more can be done. Of course, there has been a lot of, I would say, investment over the years, but maybe not enough. And also, more importantly, being able to ensure that the most important tire, which for us is the community health tire, gets the recognition and the support that is required. Because we've seen, even with the experience with COVID, that this is also where the difference was made, because you have community health workers coming from these same communities, and when they have the knowledge, capacity, and the tools that they require, then it can make a lot of difference, not just during an emergency like COVID, but on a continuous basis, because these are people who know the households, they know the families, and they can follow them and continue to advise, but also then link them up to the health facilities in terms of referrals. And maybe to this end, also just to mention that as IFRC, we are working closely with Africa CDC on the issue of scaling up the number of community health workers on the continent out of a decision that was taken by the heads of state of Africa. And I think for me, this will be the game changer, that if we can increase this number, then not only just the number, but also ensure that they receive the training that they require to be able to have the skills that are necessary, and then be given the tools, and of course support them in terms of remuneration to be able to continue to do this particular task.
You mentioned the strong community-based public health responses, which was a positive during COVID-19 pandemic in Africa. Are there other lessons that we could learn from the pandemic?
Yes, a lot of lessons. Of course, a good coordination, with this, was critical. And I know in many countries, the governments stepped in and had structures which were multi-sectoral, which was also the other question. Like we said, having everyone working together, bringing in all the different sectors, and not only the health sector, but every other sector in the society, because it affects not just the health sector, but also, there were economic impacts, and therefore businesses and private sector also needed to be involved and to contribute. Again, like we said, the community part was critical, being able to ensure that communities are getting the messages, the correct messages, to be able and to ensure that they prevent even the spread of COVID within their own communities. So I think there's a lot of aspect there. But of course, we also learned that we need to be better prepared in terms of even some of the, you can say, our health facilities, in terms of having the infrastructure, in terms of having some of the necessary equipment, and that a lot of it could also be done on the continent. And I think now there are quite some good initiatives in terms of vaccine production. We saw that people were even able to produce masks because even the supply chain was disrupted. So when you can't even import some of these things, you need to have the capacity locally to be able to do it if you are going to be able to have an effective response.
Another issue that we cannot not touch upon is climate change. Of course, you've also paid close attention to that over the years, and you've been to the climate change conferences, or the better known as COP conferences. What is your message on the climate crisis to the world, and specifically to the African Union?
I think we don't need a lot of discussions anymore in terms of, whether it's happening or not. I think there's enough evidence. And even as we speak today, we can see what's going on. So we need to spend much more time looking at the solutions, mobilizing the resources that are needed to act. Good to have these conferences, and I have attended a couple of them. But I would say that there are a lot of good examples of what works. So it's about also how we can bring that together and work at scaling that. It's also about, again, building the necessary capacities for those that need to act to be able to do that. So I believe we are at a critical junction, and therefore a bit of a change of strategy. I think we don't need to convince people more than probably we've already done, because the effects are felt everywhere, and not only just Africa. I think we've seen it globally. So it's a little bit getting to the actual action to prevent the many lives that are being lost because of climate change. And I always like to say one life lost is one too many.
Mm-hmm. Absolutely. And just today, we're only on the African continent. We have floods in Kenya and Tanzania, and droughts in South Africa at the same time.
Absolutely.
So,
and not forgetting that even for those communities in Kenya and Tanzania that are experiencing floods, they just came from 3.5 years of drought.
mm-hmm.
So no time to recover from one disaster to another.
If I may turn to your Red Cross journey, and your role as a woman leader, so that's what the Red Cross is also all about, right?
Yeah, absolutely.
So it fits you very well.
Yeah.
So in closing, Dr. Asha, with all that's going on in the world, at the end of the day, who and what inspires you, keeps you going, or even gives you comfort or hope?
First and foremost, I would say my faith plays a big role as a Muslim, as much as it was also one of the issues that made me struggle a lot, because, as a Muslim woman, trying to be a leader and a manager in all kinds of spheres, it was always not easy. But I have the belief and the faith that my Maker has a plan for me. And every day I wake up, I tell myself the reason why I'm still awake today is because he still wants me to do something. And I also have the conviction that and the belief that whatever I get today or wherever I am, it's not because of me, but it's because Allah wants me to pass that to somebody else. And that's why the Red Cross for me is probably the best thing that happened to my life, in the sense that it gives me the platform to make that difference in people's lives. And I feel privileged, even now in this role that I have, that I can bring the voices of those that are affected, for people to actually be influenced or feel the need that they need to do something about it. So I would say my faith plays a big role. My family has been very supportive. I have 2 daughters, and they are my biggest cheerleaders. Even when I feel like, no, I'm about to crash or to give up, they're like, no, you can do it. Like, you can do it. And that keeps me going, because I also look at them and feel that, like we said, it's also about, it's not me. Tomorrow, I would want them to be in the same position that I find myself. So they need to keep seeing me going on, and they need to keep seeing moving, because if I give up, then it's not a good message that I'll give them as, as young women growing up.
How old are they?
25 and 30. I also have, I would say, a passion of the communities, because every time you go to the community and you see how resilient they are despite the challenges they go through, and with the support of the Red Cross or Red Crescent societies, you are able to see, the difference that we make in their lives in even a very small way. That for me is a big motivation. So sometimes even when you feel it's a bit hopeless, but you go and you see that communities, are still trying to make a better life for themselves, then you feel that, you need to be part of that. Yeah.
So the name of the podcast is People in the Red Vest.
Yes.
What does this red vest, which symbolizes the Red Cross, mean to you?
For me, it's a sign of hope. It's a sign of hope. And I know, because I've worked for Africa as well, for the IFRC, and when you have the red vest with you, irrespective of where you go, people look up to you, and they know that because you're there, help has arrived. Because you're there, support has come. But because you're there, then they know that their situation is temporary, and you will do what you have to do to make sure that they get to a better place.
Thank you, Dr. Asha. It's been a real pleasure, and thank you for allowing us to get to know you a little bit.
Thank you too for having me, and for the opportunity as well.